Hi, hello there. This is Dr. Ansari. I'm with the TeleNeuro program at the University of Utah. And then is this patient Fletcher?
Yes. It is. Hi, Dr. Ansari. This is Dr. Jones.
Excellent. And Dr. Jones, thank you for the consult. I had the time to review the story briefly. I've reviewed some of the records that were shared with me by your coordinator, and I've looked at the brain MRI. My understanding is that the patient has had a seizure and then has presented to your care with right lower extremity weakness as well. Is that correct?
That's correct. The patient does not have a history of seizure. She's amnestic to the event, but her boyfriend, who is in the waiting room, described a tonic-clonic movement for a couple minutes. Her eyes were rolled back. And when she came in, she was pretty confused. That's gotten better. As her confusion has waned, we have noticed that she's had this persistent weakness in the right leg, which prompted us getting the MRI and contacting you.
Okay, well, Dr. Jones, thank you. So her confusion and stuff is getting better. Are there anything else that you've noticed, like in her clinical picture or labs, that is concerning to you that you want to bring up?
Initially, she had a lactate of 5. We gave her a liter of fluid, and that's come down to 2 on repeat testing. So,
excellent.
Other than that, CMP and CBC looked okay. We have a tox panel that's pending.
Good, very good. Now, I also saw a CT scan and a brain MRI, and I was able to pull up the images. Thank you for transferring them. They looked very normal to my interpretation. Is that what your radiologist also agrees?
It is, yeah.
Okay. And patient Fletcher, are you able to answer questions for me?
I think so.
And my understanding is that this has never happened to you before.
Yeah, I don't think it has.
And do you have a history of febrile seizures or seizures that associated with fevers when you were a child? Does your mom ever tell you that story?
No.
Is there anybody in your family that has seizures or what we call epilepsy?
No.
Okay. Have you ever had brain injury, like a car accident or any trauma to your head?
When I was like 2, a rather large boulder fell on my head.
Did you lose consciousness? Did you end up in the hospital? Was there anything concerning that you remember?
Well, I just recall a lot of blood, but I don't remember losing consciousness, and I did not go to the hospital.
And then, do you remember, like, when you were growing up, do your parents tell you that you began to walk and talk and everything at the normal time? Or do you remember any stories of there being any delays in your development?
No, I do not.
Okay. Have you ever had any reason to get a brain scan or see a brain doctor before in your life?
No.
Okay. And no brain surgeries, I assume?
No.
Okay. In the last couple of weeks or months, and I apologize, this is a very direct question, have you tried any drugs?
No.
How many times a week do you drink?
3.
And have you ever had a drink because you felt jittery and you had to have a drink, you needed to?
No.
Okay, very good. Dr. Jones, I think this was a pretty simple, straightforward history. I'm not detecting any signs or risk factors for epilepsy. Was there anything else on the history that you noted that was pertinent?
No, and initially we sort of were comfortable with a first seizure. It's the weakness that got us a little concerned.
Yes. And so let's go ahead and examine her. Of course, we're going to do a neuro exam on camera, so we'll have to tag team it. And patient Fletcher, would you mind just looking straight at the camera, opening your eyes wide, please? All right. With your eyes, just look all the way to the right. Look all the way to the left. Good. Look all the way up at the ceiling. Good. Awesome. Okay. Would you mind removing your mask for just 1 second and then showing me your teeth wide in a smile? Good. Can you stick your tongue out like you're sticking your tongue out at me? Good. You can put your mask back on. Thank you. Can you raise both your arms like you're holding up a tray? All right, hold them up a little bit higher. Perfect. Now keep your eyes closed. I'll count you down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Very good. Dr. Jones, can we check a quick finger to nose on either side?
Sure. I'd like you to take your index finger here, touch my finger, and then go back to your nose. Back and forth. And good, okay.
Very good. Other side?
Other side?
Very good.
Very good.
All right. Now, as you brace your hands on the stretcher, can you lift one leg, please? Left leg first.
Left side?
Yes. All right. Hold it up. 1, 2, 3, 4, 5. Now, can you put that down? Can you raise your right leg, please? Give it a shot. Give it a shot. Give it your best effort. You're doing great. You're doing great. Okay. Keep it up. Keep it up. Keep it up. Keep it up. All right. You can put it down. You can put it down. Dr. Jones, is that what you noted earlier as well?
You know, it's actually improved a little. She was initially not getting the leg up off the bed. So not
This is better.
yeah, it's improved. Obviously not as good as the left side, but
Can we check for sensation? So patient, can you please keep your eyes closed? Dr. Jones, could you just give her a light scratch on both hands and both legs? And let's see, patient, do you feel them equally on both sides?
Yes.
Is that equal on both sides?
she said more on the left side.
Okay, very good. So I do think there's a mild sensory change as well associated with the improving weakness in this right leg. Okay. Was there anything else on exam that you noted, Dr. Jones?
No, I checked the reflexes and they seemed okay.
Okay. Very good. I think
Yeah,
we have,
other than that, to orientation, she's gotten better, but still kind of not quite at baseline, we don't think.
got it, got it. But improving orientation, improving awareness, improving right leg weakness, and still some subtle sensory change in the right leg. And as you mentioned, pretty normal labs now that the lactate is improving, and a very normal brain MRI, no seizure risk factors from history that we could elicit from personal or family history. I would think that this is the first onset seizure, not necessarily a diagnosis of epilepsy at this point, but if she were to have a second seizure that is not provoked, then we would definitely consider a diagnosis of epilepsy. Are you able to get an EEG at your hospital?
We could get one as an outpatient.
Okay. So here's what I would recommend. First things first, I think that right now we don't need to start any anti-seizure medications on a long-term basis because it is a first only seizure. As far as the leg weakness and the sensory change, if it is improving, and please continue to monitor it, I suspect that this is a seizure phenomenon called Todd's paralysis, and if it continues to improve, then I think that is very reassuring. I think that the normal brain MRI makes us even more reassured that there's no lesion or stroke that we need to worry about. And as far as the lactate on the labs, if that continues to improve, that's reassuring as well. And I'm sure you'll check the drug panel and the tox screen and make sure that that's negative as well. As far as the EEG, I think that that can be deferred as an outpatient. I suspect it may be normal. I suspect it may show some focal abnormalities on one side. And if your hospital does not have the ability to do inpatient EEGs, that's absolutely fine, as long as we can get an outpatient EEG as soon as possible after discharge. Does that sound like a reasonable plan to you, Dr. Jones?
It does, yeah, and I could have her also follow up with our local neurologist. How soon do you think we should get her in for follow-up?
I think that if the local or site neurologist can see her within the next 2 to 4 weeks, hoping that we can get the outpatient EEG done before then, that would be the most ideal follow-up. Also knowing that if for any reason you would like to send her here, we can also see her in our neurology clinic, or if you, patient Fletcher, would like to follow up with us, that is an option available to you as well.
Great. Okay. Thank you so much. I appreciate it. We'll let you know if the weakness doesn't get better.
Excellent. I don't foresee any need for further teleneuro consultation unless something changes. And if you don't have any further questions, I'll simply ask you to just confirm what our plan is so that I know both of us are on the same page. And my note and documentation will probably be available to you by tomorrow morning.
Great. So the plan, as I understand it, is we'll continue to monitor, recheck her lactate, and if she goes back to baseline in the next couple hours, we'll discharge her, have her get an outpatient EEG, and follow up in 2 to 4 weeks with neurology here or at the university. If her weakness or mental status don't normalize, I think we'd admit her, and potentially we'll just contact you before admitting her. We might want to transfer her at that point.
Yes. If any of these symptoms don't go away or get worse, or if you have any other concerns, please schedule another consult with us tomorrow, and we are happy to facilitate either further workup or accept her to our facility and transfer.
Great. Okay. Thank you, Dr. Ansari.
Thank you, Dr. Jones.